I'm Elsie, an oncology nurse, and this is Deb. She's a social worker. We work together in an outpatient setting. I asked Deb to come out and help me today because myself and Fanina, another colleague, is doing a presentation on caregiver burden and strain. And we work closely with our social work department, and their perspective is really needed, especially on this subject. So I would love if you could kind of give us some pointers as the first line in meeting patients and caregivers, any communication skills you could elaborate on.
Sure. So I think one of the best things is that we actually all work together very well. And so one of the things that helps us the most is the fact that you guys are frontline people. You are going to be the first contact for a lot of these patients and family. So what I tend to look at is the big thing, overriding thing, is observation. So kind of observing how the patient interacts with the support person and what you kind of get from the support person. So if you watch how that person reacts to what the patient says, or the kinds of questions that the support person asks you guys as the nurse, two things to think about is if they don't ask any questions. So what does that say? It may be that they're too worried about what's going on, or that they just don't know what to ask, or there's always a lot of possibilities, or that they just aren't sure how to support the patient. Because a lot of times this is just so new to them, what cancer is and what it means, that they just don't know what to do. The other thing you might find is that a patient's support person asks a lot of questions, and then they have their own anxiety. And that's something to pay attention to, because if a support person, we're looking to them to support the patient, if they have a lot of their own stuff or their own anxiety, that's going to impact our patients tremendously, and that support person may really struggle with how to take care of themselves. And if they can't take care of themselves, a support person is not going to be able to help our patients, right? So that's the observing whether they ask questions, or also how they react to the patient, and even to you. Sometimes people, to you as the nurse, I should say, sometimes support people kind of watch you. I'm sure I've seen this, watch you very closely in everything you're doing. And it's partially because they're out of control. They're not in control of what's going on. So kind of get a sense of whether they're control people or not. If they aren't that in tune and watching everything, they may be someone who doesn't take control of the situation and might need some help from you guys explaining, look, here's something you can do, here's something, that might not be as helpful. And you can even make suggestions about what works for them. So even engaging them in a conversation about how they take care of themselves or how they handle stress. That's a big one. So do they like to listen to music? Do they go outside? Do they go ice skating? Who knows? A lot of people cope in a lot of different ways. And so just by giving a caregiver a place to say something actually is a huge help, even if it's a 2-minute conversation. And then probably another quick thing to keep in mind is how they, how often they come with a patient. And, if you observe them from one visit to the next, and just kind of see if they evolve, in a sense, the caregiver, in terms of questions they ask or how they do with the patient, or whether that panic face goes away, because we know we see that an awful lot. And just kind of watch them over time, and then be able to pass that information certainly to the rest of the team, because that kind of observation then allows the social worker to provide the support long-term to the family as well.
Wow, that was really good. Thank you so much, Deb. Very nice.
You are welcome.
Okay, I think we can end on that because that was really great.